Welcome to another episode from the Veterinary Medicine Digest. Today, we're diving deep into a topic that concerns dog owners and veterinarians across the globe: two sneaky, tick-borne diseases known as Ehrlichiosis and Anaplasmosis. These infections are becoming more common and are expanding into new geographic areas, making it more important than ever to understand what they are, how they affect our canine companions, and what we can do about them. We'll explore everything from the microscopic culprits that cause these illnesses to the clinical signs you might see in your dog, the intricate diagnostic process, and the gold standard treatments that can bring them back to health. So, grab your headphones, and let's get started. Unmasking the invisible invaders. What are Ehrlichiosis and Anaplasmosis? At their core, Ehrlichiosis and Anaplasmosis are diseases caused by a group of bacteria that are experts at hiding. These aren't your typical bacteria that you might find in a contaminated wound. These are obligate intracellular bacteria, which means they must live inside the cells of their host to survive and multiply. Specifically, they belong to the genera Erlichia and Anaplasma, which are tiny, gram-negative bacteria that primarily infect the white blood cells of mammals. Once inside a host cell, like a monocyte or a neutrophil, they form tiny colonies known as moruli, which look like little clusters or berries under a microscope. These diseases have a worldwide distribution, found on nearly every continent except Australia, and their prevalence is on the rise. This expansion is linked to factors like climate change, which affects tick habitats, and the increased movement of pets through travel and trade. The main mode of transmission is through the bite of an infected tick. In Europe, and indeed much of the world, three main species are of concern for dogs: Erlichia canis, which causes a disease called canine monocytic Ehrlichiosis; Anaplasma phagocytophilum, the agent behind canine granulocytotropic anaplasmosis; and Anaplasma platies, which leads to a condition known as infectious cyclic thrombocytopenia. Let's break down each of these in more detail. Canine monocytic Ehrlichiosis, the story of Erlichia canis. The most well-known of these diseases is canine monocytic Ehrlichiosis, or CME, and its primary cause is the bacterium Erlichia canis. This particular species has a notorious reputation. It was first identified way back in 1935, but it gained significant attention during the Vietnam War when many military working dogs suffered from a severe illness then called tropical canine pancytopenia, which was later identified as CME. Erlichia canis primarily infects a type of white blood cell called the monocyte, which is where the monocytic part of its name comes from. However, as we'll discuss later, it can sometimes surprise us by showing up in other cells. While Erlichia canis is the main player, other Erlichia species can also infect dogs, particularly in North America. These include Erlichia chafensis, which also causes a monocytic form of the disease, and Erlichia ewingii, which causes a granulocytotropic form, meaning it infects granulocytes like neutrophils. These two species are often transmitted by the lone star tick, Amblyomma americanum, and their presence in dogs often mirrors the geographic range of this tick, primarily in the southeastern and south-central United States. Interestingly, one large survey found that Erlichia ewingii is actually the most seroprevalent, or most commonly exposed to, Erlichia species in dogs in the United States. The ticks and transmission routes. The primary villain responsible for spreading Erlichia canis is the brown dog tick, Rhipicephalus sanguineus. This tick is incredibly well adapted to living with dogs and can complete its entire life cycle indoors, making it a year-round threat in homes and kennels, especially in warmer climates. The transmission process itself is quite efficient. When a tick feeds on an infected dog, it ingests the bacteria. The bacteria then multiply within the tick's gut and salivary glands. An important concept here is transstadial transmission, which means that if a tick larva or nymph becomes infected, it will remain infectious as it molts into its next life stage. So, an infected nymph will become an infected adult, ready to pass the pathogen to its next host. However, Erlichia canis is generally not passed from an adult female tick to her eggs, a process called transovarial transmission, which means tick larvae are not born infected. A study has shown that an infected brown dog tick can start transmitting E. canis to a dog in as little as 3 hours after attaching, highlighting the need for fast-acting tick preventatives. For a long time, tick bites and, less commonly, blood transfusions were considered the only ways a dog could get Ehrlichiosis. However, recent research has unveiled a more direct and insidious route: vertical transmission. A groundbreaking study in Brazil provided the first molecular evidence that Erlichia canis can be transmitted from a pregnant mother to her puppies across the placenta. Researchers analyzed samples from naturally infected pregnant dogs and their offspring. They found Erlichia canis DNA not only in the mother's blood but also in placental tissue, in the organs of stillborn puppies, and even in the blood of a live-born puppy that had no exposure to ticks. This is a huge discovery because it confirms that dogs can act as reservoirs for the disease, potentially maintaining the bacteria within a population even in the absence of ticks. This finding complicates control strategies that focus solely on killing ticks. The 3 phases of Ehrlichiosis. Clinical presentation. Canine monocytic Ehrlichiosis is often described as a disease with 3 distinct phases: acute, subclinical, and chronic. Distinguishing between these phases in a naturally infected dog can be difficult, as the signs often overlap, but understanding them is crucial. The acute phase typically begins 8 to 20 days after the tick bite. The clinical signs during this stage are often vague and nonspecific, which can make diagnosis tricky. You might see lethargy, inappetence or anorexia, weight loss, and fever. On physical examination, a veterinarian might find enlarged lymph nodes, lymphadenopathy, and an enlarged spleen, splenomegaly. One of the most classic signs, however, is related to the bacteria's effect on platelets. Thrombocytopenia, or a low platelet count, is the most common laboratory finding in all phases of the disease. This can lead to bleeding problems, such as nosebleeds, epistaxis, tiny red or purple spots on the gums or skin, petechiae, and larger bruises, ecchymosis. The severity of the acute phase can vary dramatically. Some dogs may be very ill, while others show only mild signs of not feeling well. Following the acute phase, many dogs enter a subclinical phase. During this stage, the dog appears perfectly healthy and shows no outward signs of illness. This phase can last for months or even years. The dog's immune system has suppressed the bacteria but hasn't completely eliminated it. The only clue might be a persistently low platelet count found on routine blood work. These dogs are silent carriers, capable of transmitting the infection to ticks that feed on them. It's an unpredictable waiting game, as some dogs in this phase will eventually manage to clear the infection on their own, while an unknown number will progress to the most devastating stage of the disease. The chronic phase is the most severe and life-threatening form of Ehrlichiosis. This is where we see the most profound effects of the disease. Dogs in this phase often present with severe weight loss, persistent bleeding, and debilitating weakness. Ocular problems are common and can include inflammation inside the eye, uveitis, bleeding into the eye, hyphema, retinal detachment, and even blindness. In some cases, neurological signs like seizures or ataxia can occur, often due to inflammation of the meninges, the membranes covering the brain and spinal cord. The hallmark of severe, chronic Ehrlichiosis is bone marrow suppression. The bacteria can damage the bone marrow's ability to produce new blood cells, leading to a condition called aplastic pancytopenia, a drastic reduction in red blood cells, white blood cells, and platelets. These dogs are severely anemic, highly susceptible to secondary infections due to a lack of white blood cells, and at extreme risk of life-threatening hemorrhage from the low platelet count. The prognosis for dogs with this form of the disease is unfortunately grave. Certain breeds, particularly German Shepherds and Siberian Huskies, seem to be predisposed to developing these more severe, chronic forms of the disease. Studies suggest this may be due to a difference in their cell-mediated immune response, which is less effective at controlling the infection compared to other breeds like beagles. Canine anaplasmosis, the other tick-borne troublemakers. Now, let's shift our focus to anaplasmosis. While related to Ehrlichiosis, this disease is caused by bacteria from the genus Anaplasma and presents a different, though sometimes overlapping, clinical picture. In dogs, we are primarily concerned with 2 species. First, there is Anaplasma phagocytophilum. This bacterium causes what is known as granulocytotropic anaplasmosis because it infects granulocytes, specifically neutrophils and sometimes eosinophils. This pathogen has a bit of an identity crisis in its history. It was previously known by several other names, including Erlichia equi, but genetic sequencing later placed it firmly in the Anaplasma genus. This organism is also a significant zoonotic pathogen, meaning it can infect humans, causing a disease called human granulocytic anaplasmosis, which is a serious and emerging illness. The second species is Anaplasma platies, the cause of thrombocytotropic anaplasmosis, also known as infectious cyclic thrombocytopenia. As its name suggests, this bacterium infects platelets, the small cells responsible for blood clotting. It too was once called Erlichia platies before being reclassified. Vectors and geographic spread. The vectors for these 2 Anaplasma species are different, which dictates their geographic distribution. Anaplasma phagocytophilum is transmitted by ticks of the Ixodes genus, often called deer ticks or black-legged ticks. In the United States, the main vectors are Ixodes scapularis in the eastern and midwestern regions and Ixodes pacificus in the west coast. In Europe, the castor bean tick, Ixodes ricinus, is the primary vector. Because these are the same ticks that transmit Lyme disease, co-infections with both Anaplasma phagocytophilum and Borrelia burgdorferi, the agent of Lyme disease, are quite common in dogs from endemic areas. The prevalence of this disease is highest in the northeastern, upper Midwestern, and Pacific Northwestern United States, as well as parts of Canada and northern and central Europe, mirroring the distribution of these ticks. Anaplasma platies, on the other hand, shares its primary vector with Ehrlichia canis, the brown dog tick, Rhipicephalus sanguineus. Consequently, infections with A. platies are often found in the same tropical and subtropical regions where canine monocytic Ehrlichiosis is endemic, including the southern United States, the Mediterranean basin, and parts of Central and South America, Africa, and Asia. Clinical signs of anaplasmosis. The clinical presentation of anaplasmosis varies depending on the infecting species. An infection with Anaplasma phagocytophilum is typically an acute disease, with an incubation period of 1 to 2 weeks. The illness is generally milder than what is seen with Ehrlichia canis and is often self-limiting. The most common clinical signs are nonspecific and include lethargy, fever, and a poor appetite. Many dogs will exhibit musculoskeletal pain, stiffness, or lameness, which is often due to an immune-mediated polyarthritis where the body's own immune system attacks the joints in response to the infection. As with Ehrlichiosis, thrombocytopenia is the most common laboratory abnormality, but other findings can include anemia and elevated liver enzymes. While considered an acute illness, some studies have documented that persistent, subclinical infections can occur, lasting for months to a year, especially if the dog is not treated with antibiotics. Infection with Anaplasma platies is best known for causing its namesake, infectious cyclic thrombocytopenia. During the acute phase of infection, a dog's platelet count will drop dramatically and then rebound, following a predictable cycle of approximately 10 to 14 days. This is thought to be caused by the immune-mediated destruction of infected platelets. Interestingly, many dogs, particularly in the United States, remain completely asymptomatic despite these dramatic fluctuations in their platelet counts. However, in other parts of the world, like Europe and South America, infections with local strains seem to cause more severe clinical signs, including fever, lethargy, weight loss, and bleeding issues like epistaxis. Even if asymptomatic, the condition is not entirely benign. A dog with a severely low platelet count is at high risk for serious bleeding if it undergoes surgery or suffers trauma. The diagnostic puzzle. How do we confirm an infection? Diagnosing Ehrlichiosis and anaplasmosis can feel like putting together a complex puzzle. There is no single test that is perfect in all situations, and a negative result from any one test does not definitively rule out an infection. Therefore, veterinarians often rely on a combination of clinical signs, laboratory findings, and specific diagnostic assays. Starting with the basics, clinical and laboratory clues. The first step is always a thorough history and physical exam. A history of tick exposure in a dog presenting with nonspecific signs like fever, lethargy, and poor appetite should raise suspicion. On the laboratory side, the most consistent and important finding for all of these diseases is thrombocytopenia, or a low platelet count. If a sick dog from a tick-endemic area has a low platelet count, these diseases should be high on the list of possibilities. Other common findings on a complete blood count include a mild, non-regenerative anemia and, in more chronic cases of Ehrlichiosis, changes in white blood cell counts and high levels of globulins in the blood, hyperglobulinemia, which reflects the strong antibody response the body is mounting. Looking for the culprit, microscopic examination. A direct way to diagnose these infections is to find the characteristic moruli inside the host cells on a stained blood smear. However, the usefulness of this technique varies significantly. For Ehrlichia canis, finding moruli and monocytes on a peripheral blood smear is actually quite rare, occurring in less than 10% of clinical cases. The chances are slightly better if a veterinarian examines a buffy coat smear or, even better, a fine needle aspirate from an enlarged lymph node, where the organisms might be more concentrated. In a fascinating recent case, a dog presented with severe neurological signs of meningomyelitis. Analysis of its cerebrospinal fluid revealed neutrophils containing Ehrlichia canis moruli, an unusual finding since E. canis is known for infecting monocytes. This case highlights that we should keep an open mind about where these organisms can be found. For Anaplasma phagocytophilum, microscopy is more fruitful. During the acute phase of the disease, moruli can be seen inside neutrophils in up to 60% of infected dogs, making it a reasonably sensitive diagnostic tool. For Anaplasmoplates, moruli can be seen within platelets, but again, the sensitivity is generally low, especially outside the periods of high bacterial numbers in the blood. Detecting the immune response, serology. Serology, or antibody testing, is a very common method for diagnosing exposure to these pathogens. In-clinic tests, like the popular IDEXX SNAP 4DX Plus test, are enzyme-linked immunosorbent assays, ELISAs, that can quickly screen for antibodies against Ehrlichia species, Anaplasma species, and Borrelia burgdorferi, Lyme disease, as well as antigen for heartworm disease. However, there is a critical point to understand about serology. A positive result indicates exposure to the organism, not necessarily an active, ongoing infection. Antibodies can persist in the bloodstream for months or even years after the dog has successfully cleared the infection. In highly endemic areas, many healthy dogs will test positive simply due to past exposure. This is why one study in Trinidad found very poor agreement between the results of the SNAP 4DX test and PCR. The SNAP test was detecting many dogs with past exposure, while the PCR was only detecting dogs with active infections. So, how can serology be used more effectively? One way is to take paired samples. A blood sample is taken when the dog is sick, the acute sample, and another is taken 2 to 4 weeks later, the convalescent sample. A fourfold increase in the antibody titer between these two samples is strong evidence of an active infection. It's also important to note that it takes time for the body to produce antibodies. A dog may test negative in the very early stages of infection, usually the first 1 to 2 weeks, before it has had time to seroconvert. Finding the smoking gun, polymerase chain reaction (PCR). Molecular testing, specifically the polymerase chain reaction or PCR, has become a cornerstone of diagnosis for these diseases. PCR works by detecting the specific DNA of the pathogen in a sample, usually blood. Its advantages are numerous. It is highly sensitive and specific. It can detect an active infection, since it's looking for the organism itself, not the body's response to it, and it can identify the exact species of Ehrlichia or Anaplasma involved. However, PCR is not without its limitations. A negative PCR result never completely rules out infection. This is especially true in the subclinical or chronic phases, when the number of bacteria circulating in the blood, bacteremia, may be very low or intermittent, falling below the detection limit of the test. The bacteria may be sequestered in tissues like the spleen or bone marrow and not present in the blood sample that was tested. For this reason, testing tissue samples like splenic aspirates can sometimes be more sensitive than blood, especially for chronic infections. Ultimately, the most powerful diagnostic approach is to combine serology and PCR. This combination provides a more complete picture, helping to distinguish between past exposure and active infection across the different stages of the disease. Treatment and prevention, the path to recovery and protection. Once a diagnosis of Ehrlichiosis or Anaplasmosis is made, the good news is that these infections are generally very responsive to treatment, especially when caught early. The antibiotic of choice, doxycycline. The undisputed king of treatment for both Ehrlichiosis and Anaplasmosis is the antibiotic doxycycline, which belongs to the tetracycline family. It is highly effective and is considered the first-line therapy. The standard recommended dose is typically 10 mg per kilogram of body weight given once daily, or 5 mg per kilogram given twice daily. One of the most critical aspects of treatment is the duration. The consensus recommendation is a course of at least 28 days, or 4 weeks. This is extremely important because dogs often show a dramatic clinical improvement within just 24 to 48 hours of starting doxycycline. It can be tempting for an owner to stop the medication once their dog seems back to normal, but finishing the full course is essential to increase the chances of completely eliminating the bacteria and to prevent the development of a persistent, chronic infection. There are a few practical tips for administering doxycycline. In cats and small dogs, the tablets can sometimes get stuck in the esophagus and cause inflammation or even a stricture. To prevent this, it's recommended to give at least 6 milliliters of liquid, like water, immediately after pilling the dog, or to use a liquid formulation of the drug. Also, tetracyclines can bind to calcium, which reduces their absorption. Therefore, it's best to avoid giving the medication with calcium-rich foods like dairy products. Treatment challenges and alternatives. While doxycycline is highly effective at resolving clinical signs, there is some debate about whether it achieves complete sterilization, or eradication of the organism, in every single case, particularly with chronic Ehrlichia canis infections. Some experimental studies have found that even after a full 28-day course of doxycycline, some dogs remained PCR positive or were still able to transmit the infection to ticks that fed on them. This suggests that in some chronic cases, the bacteria may persist in deep tissues despite treatment. If a dog cannot tolerate doxycycline due to side effects like vomiting, or if it is unavailable, minocycline is a reasonable alternative with similar efficacy. Rifampicin has also been investigated and may have some effect, but it is not considered a first-line treatment and more research is needed. It's important to know which drugs are not effective. Imidocarb dipropionate and enrofloxacin have been shown to be ineffective against Ehrlichia canis and should not be used for this purpose. Supportive care for severe cases. For dogs with severe disease, especially those with chronic, myelosuppressive Ehrlichiosis, supportive care is just as important as the antibiotic therapy and is often essential for survival. This can include intravenous fluid therapy to correct dehydration, blood transfusions for dogs with severe anemia or life-threatening bleeding, antiemetics to control vomiting, and nutritional support for dogs that are persistently anorexic. The use of glucocorticoids or steroids in these diseases is controversial. They are generally not recommended as part of the initial treatment because doxycycline is so effective on its own, and steroids can further suppress the immune system. However, in cases with severe, documented immune-mediated complications, like a severe immune-mediated thrombocytopenia or uveitis that is not responding to antibiotic therapy alone, a veterinarian might consider adding a course of anti-inflammatory or immunosuppressive steroids. The best medicine, prevention. Since there are currently no commercially available vaccines for canine Ehrlichiosis or Anaplasmosis, prevention is all about one thing: tick control. Because prior infection does not provide reliable, long-lasting immunity, a dog can be reinfected if exposed to another infected tick. Therefore, the most effective strategy is to implement a robust, year-round tick prevention program. This involves using effective acaricides, products that kill ticks, such as spot-on treatments, oral medications, or collars. It is crucial that these products are fast-acting to kill ticks before they have time to transmit pathogens. In addition to medication, prevention includes promptly removing any ticks found on your dog, being careful to remove the entire tick including the head. Environmental management is also key, especially for controlling the brown dog tick, which can infest the home and yard. This includes keeping lawns mowed, clearing brush, and creating barriers like wood chips or gravel between wooded areas and your yard. The bigger picture, zoonotic implications. Finally, it's important to remember the One Health perspective. While there is no evidence of direct transmission of these pathogens from dogs to humans, an infected dog serves as a sentinel, indicating that infected ticks are present in the environment. This means that the people and other pets living in that environment are also at risk of being bitten by those same ticks. Anaplasma phagocytophilum is a well-established cause of human disease. Other species, like Erlichia chafensis, Erlichia ewingii, and even an organism closely related to Ehrlichia canis, have also been reported to cause illness in people. Therefore, protecting our dogs from ticks is also a crucial step in protecting our own health. In conclusion, Ehrlichiosis and Anaplasmosis represent a significant and growing threat to canine health worldwide. These tick-borne diseases, caused by intracellular bacteria, can range from mild, self-limiting illnesses to severe, life-threatening conditions characterized by bone marrow failure. Diagnosis is a multi-step process that relies on recognizing clinical signs, identifying key laboratory abnormalities like thrombocytopenia, and using a combination of serological and molecular tests to confirm the presence of the pathogen. The cornerstone of treatment is a full, 4-week course of doxycycline, which is highly effective at resolving clinical disease, though questions remain about its ability to sterilize every infection. Ultimately, with no vaccine available, the most powerful tool we have in the fight against these diseases is prevention through diligent, consistent, year-round tick control. By understanding these complex diseases and taking proactive steps to protect our dogs, we can ensure they live long, healthy, and happy lives by our side. Thank you for listening. The titles for the reference papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.